Dr. Auerbach, let's talk about TMJ. Don't make me pronouncing the big word, which this really means, because I can't. But you might, please, for our listeners. In any case, joint problems and what goes with it, and why a dentist is so important there.
Okay. Well, TMJ stands for temporomandibular joint. Which basically everybody has two. They're right there right in front of your ears. You can feel them moving when you open and close your jaws. A better name for that problem out there that people call TMJ would be craniomandibular dysfunction, meaning that the lower jaw doesn't relate to the upper skull in an ideal physiologic pattern. Now, all of your joints usually are controlled by the bones and the muscles and the ligaments. Your jawbone, though, there's two joints for one bone, which is different than all your other joints. Plus, you have teeth that need to touch, and when they touch, they may make the jaw move sideways or something where it's not in the ideal position. So that's the problem that we're talking about. Now, usually, human bodies adapt, so if you're off a little bit, it's not too much of a big deal. But if you're off a little bit more, or you have extra habits like clenching, grinding your teeth, chewing a lot of gum, where if your jaws aren't aligned ideally, you could start to have problems. Most problems are muscle related, and so if it's off and the muscles are sore and tired, it can lead to headaches, neck aches, and that could work down to your neck. It can work down to your lower back, all the way down to your feet, and it can work the other way too. If the way you walk is creating a little bit of an off balance, then the next joint, your knees, and then your hips, and then up each of your vertebrae up your spine till it gets up to your head, could cause different in your head tilt and stuff like that. And all that strain on this whole musculature can lead to headaches and neck aches. So it works both ways.
So what you're saying is that while a dentist might repair the joints and somehow, and you're going to tell me a little bit later or tell us how, some of the ways on how to do that, but while a dentist can and must fix that once it has reached there, it might have originated right here. And I think you said something down the road a while ago with like missing teeth may be the problem that it happens. Natural growth could be particular habits, as you just mentioned now, or maybe you just got punched too hard. One minute away, things could be out of alignment here, and this joint here, which I've heard, tell me yes or no fast, it seems to be one of the most complicated joint in the whole body.
Oh, it definitely is, because the way the teeth come together makes a pattern, and it makes the jaw close. It may not be ideal for the muscles, the nerves, or anything like that, but that's the way the teeth touch, so it makes the joint close in that spot. So that's why you can have a lot more complex problems. Plus, there's two, and nothing in nature is ever perfectly symmetrical, so they're going to be off just a little bit. And so that makes some more complications with how your jaw closes.
Exactly, and I can very much think with that as, because I'm basically a tool maker, mechanic. So if you have kind of two hinges, something, if one is just a little bit off, I mean, it can really create a problem. But anyway, it gets fixed here. It may originate here, but what you say, it may also originate in the back, lower back, in the knee, in the feet. So basically, a person might not realize that he has TMJ problem, which originated because he wasn't going to a podiatrist when he was young or whatever, and so for a long time, finally, it got his whole body out of alignment, something like that. Is that what you're saying? Is that what I'm getting?
Yes, that's true. So you might need orthotics in your shoes to help your foot relate. You might need to see a chiropractor to help balance the musculature. And then for the jaws, you may need to put an orthotic in there or change the bite so that the teeth fit in a position where the jaws are in a more physiologic position.
Got it.
So yeah, it can go any way.
Wow. Well, anyway, having headache, shoulder pain, neck pain in itself is just so life-consuming. You don't work well, you're irritated, you're all those type of stuff. So it's really those problems which are very, very heavy. Now, what does a dentist do to fix them? How is this a very expensive, very invasive procedure? What are we talking about here?
Okay. Well, you're absolutely correct. I mean, some people have migraines because of musculature problems that are labeled migraines, but they have these problems, and they can turn into depression because they're always in constant pain. They don't want to go out. They don't want to do things. It's just can be very, very problematic for people. Their performance at work or any sports can suffer tremendously. The fix for the joint itself up here for the jaw position is we basically want to realign and establish where it is physiologically. So we do that with TENS units, it stands for transcutaneous electrical nerve stimulation, and basically it's an electric pulse and it relaxes the muscles. What we need to do is relax the muscles because right now they're programmed the way your teeth come together. So we want to get rid of that program, let them naturally move. So we do that for maybe an hour or so. And then we want to check the positioning. So we'll take some x-rays actually of the joints called tomograms, and see how the space is. We don't want it too close to the ear. A simple test people can do is they can put their pinkies in their ears and bite down. If they feel pressure on their pinkies, their jaw's probably a little bit too far back. So we want to position that properly. So we'll relax the jaws. And then we'll take x-rays to see how that looks. We'll take a record. We'll put little, bite material, a little goop or rubbery material in there until we find a spot that looks good. And then we'll make an orthotic, which is, not something in your shoe, but it's like a retainer that has a new bite on it, teeth covering the teeth that changes how you bite. You wear that almost all the time. Just take it out to clean it, just to make sure we're doing everything non-invasively to make sure you're comfortable first and the jaws are in the right spot, that the headaches go away. Now, during this time, if there are some other issues with the spine or the back or the feet, maybe we'll get some improvement, but not as much as we wanted. So then we could see other specialties. You could see the chiropractor, the podiatrist, and we could get that evaluated. And maybe that'll change a little bit how your posture is, and then we can readjust the orthotic that's in your mouth. And so it may take us a little bit of time to get it to where it's almost perfect and ideal, and the pains are gone. Or 90% gone, instead of feeling, on a scale of 1 to 10, all the pain is a 10. You're maybe now doing a 1 or a half or maybe a 2 or something like that. So it's tremendous improvements. And then we can do something a little more invasive. Not that it's invasive, but that it's more long-term and permanent, where you don't have to take this appliance in and out. We could move the teeth with orthodontics. We could make the teeth bigger with fillings or crowns, different things like that.
Got it. Wow. That's, again, there's a whole synergy involved, which isn't surprising at all. I mean, I don't think anything is a better example of how synergy works than a body. We see it in life.
Oh, absolutely.
Yeah. So I'm glad to hear. So basically, sometimes be it a chiropractor, physical therapist, or be it a podiatrist might be needed, even though you fix it. But if the tension in the back or if there's something, it's kind of like you can go and fix your tire because your tires are flat in front, one-sided flat. You can exchange them as often as you want. You didn't change the alignment. You need to change the alignment also.
Correct. Yeah. The whole body works together. So you gotta make sure that they're all working together properly.
Well, what I like what you just told me is, and I think most people is to it's really not very invasive. I mean, it's, basically a mouth guard, and, you wear it and things get away, and muscle stimulation and maybe chiropractor work, and maybe, yes, a little orthodontic work down the road, or some normal dental work, to even it out. So it's really just a matter of balancing your joints, your bones, making the cogwheels, falling in place like a Swiss watch. That's really what it is all about.
That's correct. And sometimes if it's just a habit, like they're clenching or grinding, that's causing the extra pain. Like if you want to think of a bucket of water and you fill it up, well, there's no spill until you get that last drop that it's already full and it spills over. Well, your human body, the symptoms that you get, it's after you've had, the human body's adapting, so it takes a while. And so maybe it only takes getting rid of a habit or wearing an appliance at night when you're clenching or grinding your teeth. That is all that's needed to keep it relaxed so you're not having any trouble.
So if a person is out there, having headache, shoulder pain, back pain, has gone to a chiropractor, has taken a share of aspirin, has visited a migraine specialist. One way or the other way, the thing isn't quite going away. It may be wise for him to say, let's visit a dentist who understands TMJ, who understands the jaw, who understands that, and let's see whether there's something there. Yes?
Very good point. A lot of people don't know to look in that direction, but that's true. There could be some definite issues there.
Well, all right. Here we go. Thank you very much, Dr. Auerbach.
My pleasure.